But first of all, I'm hoping that Wes Streeting, the Shadow Health Secretary and Labour MP for Ilford North, can hear me and has joined me this morning. Wes, lovely to see you. Merry Christmas to you. I'm confused.
Good morning, Merry
because you've said recently, I don't think it's good enough that the NHS uses every winter crisis and every challenge it faces as an excuse to ask for more money. But today, the Labour Party has released a press release accusing the government of sending the NHS naked into the winter. So you're now weaponising the winter crisis, having said that they shouldn't be weaponising the winter crisis.
No, of course we recognise the winter crisis. I mean, this has become an annual feature under the Conservatives in a way that it wasn't under Labour. My criticism of the Prime Minister is that he hasn't followed through on the pledges he made back in January to make sure that the NHS wasn't as exposed to the winter as it has been in recent years. He's failed on beds, he's failed on ambulances, he's failed on delayed discharges. There are 1 in 9 people in our hospitals who are fit for medical discharge but are unable to go back into the community because the support isn't there. That's equivalent to more than 24 hospitals of patients who are well enough to leave. So my argument about the NHS is that, of course, investment and, of course, money is a challenge, but it's got to go alongside reform. And in all of the commitments that Labour has made, they're fully costed and fully funded and also directly linked to reform, because I'm concerned that thinking about the longer-term future of the NHS with a growing ageing population, rising chronic disease and rising cost pressures, unless we keep a sharp eye on the costs, they risk spiralling out of control, and not only will patients overwhelm the NHS with demand, but we'll see the NHS bankrupted because of a failure to keep a grip on costs. So I'm just trying to send a message to everyone that the public finances are in a mess thanks to this shower of a government. Money is going to be tight, and we've got to make sure that every penny of taxpayers' money is well spent. And the argument on the NHS can't just be more money, it has to be reform and modernisation. Otherwise, I fear that our NHS, as it has been for 75 years, a public service free at the point of use, something I fundamentally believe in, will be at risk.
Although, how are the Labour Party going to cope with the spiralling costs of the NHS, Wes, when you want to be giving junior doctors and others huge pay rises?
Well, look, the government has got to negotiate an end to this industrial action. It is causing untold damage in terms of cancelled appointments and
how much should they give the doctors
and procedures. Then? It also risks staff walking out of the NHS altogether. Now, I've been clear that I can't say that if there's a Labour government, we'll be able to meet the 35% pay demand of junior doctors.
If you did, you'd be bankrupting the NHS, wouldn't you?
We would be willing to sit down and negotiate. Well, and that's why I've been honest with people that the Labour Party can't just come in and meet these demands. The lesson of the last Labour government, which delivered the shortest waiting times and the highest patient satisfaction in the history of the NHS, whilst paying staff fairly, is that you've got to get the economy growing, because when the economy grows, you can invest in public services without hiking up taxes on people on lower middle incomes in the way that the Conservatives had. And that's the other reason why I'm being so firm about how much money there will be to go around, because the last Labour government was able to say, well, we'll invest in the NHS by putting a penny on national insurance. People simply can't afford tax rises on lower middle incomes now because the Conservatives have hiked them up. In fact, we had to fight them hard to get them to U-turn on their own national insurance increase.
But
so
people
that's
will be
why I
asking
make the
themselves,
argument that investment's important, but so is reform.
But people will be asking themselves, Wes, you know, at the end of the day, you're talking about the NHS being in a cash crisis and that it might go bankrupt under the Tories, but the Labour Party are likely to spend much more on it, not least if you're willing to entertain anything close to a 35% pay rise.
Well, all of the pledges we're making are fully costed and fully funded, not just on the NHS, but everything else. And in terms of our NHS pledges linked to reform, for example, the £1.1 billion that we will put into delivering 2 million more appointments a year through extra evening and weekend clinics is linked to the reform of the type we saw on the front page of the Times this week about what they're doing at Guy's and St Thomas's to significantly reduce the backlog. Our commitment to mental mental health hubs in every community and mental health support in every school is a reform investment because it diverts people away from A&E and from overstretched GPs.
Yeah.
So, and in some cases, as with bringing back the family doctor, that's not about putting more money in, that's about scrapping some of the red tape that's tying doctors up in knots, diverting them away from the care they want to be providing to patients, because we put them under about 55 accountability measures, which is just absurd. So
part of
that's
the GP
how we're thinking
crisis
in a very
was
practical and hard-headed way.
But part of the GP crisis was caused by Labour, wasn't it? Because Tony Blair allowed doctors to work for less hours for more pay because of the contract. So how are you going to unravel that? You're talking about Australia-inspired GP hubs. How are you going to staff them if doctors don't want to work the hours that my father, who was a GP in the 80s and 90s, used to work?
Well, I don't think it's fair to blame the Prime Minister that delivered an NHS so good that people were complaining that they were having to see a GP within 48 hours and were struggling to book ahead. I mean, wouldn't that be a nice problem to have now? But look, the Conservatives have run down general practice. There are 2,000 fewer GPs. Those GPs are busting a gut. They're providing 1 million more appointments now than they were before the pandemic, but there aren't enough of them, and too much of what we ask of them is pointless accountability and red tape that would be better directed in terms of that time and resource towards that family doctor relationship, which we know that GPs value and enjoy, patients really value, and all of the evidence says is crucial for getting better outcomes for patients.
Can we talk about Rwanda? Is it a safe country? One of your candidates for the Bishop Auckland seat has been sending teenagers on gap years, seemingly, to Rwanda. So is it safe or not?
Hang on, I don't think you can compare a not-for-profit programme to give young people the opportunity to engage in cultural exchange with young people from Rwanda to the government's failed Rwanda deportation scheme, which has seen hundreds of millions of pounds of our money given away and not a single flight taking off apart from the ones filled with Home Secretaries and loads of our cash.
But tell me this then.
Utterly absurd comparison. Of course, Rwanda is a place where people can go as tourists, but unless I'm mistaken, I don't think that the organisation you mentioned providing those opportunities for young people left the kids in Rwanda and flew back.
No, OK. Well, tell me this then.
I don't think we're in a serious position on this Rwanda policy because it's not delivering any real benefit to the country and it's costing a fortune.
Square this circle for us then. Say if you do get into power at the next general election and flights have taken off to Rwanda and people have been sent there, what is the Labour Party then going to do with them? Bring them back to the UK?
Well, no, they'll have been sent over there, but I can't say that I'm particularly I can't say I'm particularly optimistic about any of these flights taking off.
So you would leave these people in Rwanda?
Disaster of a scheme, and the penny has dropped for the Conservative Party.
But will you leave them in Rwanda?
As they tear themselves apart, they realise that even if this scheme is working, we'll see about 100-odd people sent to Rwanda.
Are you going to leave those people in Rwanda, Mr. Streeting?
On small boats just the other week. So I think if you have to look at the terms of the agreement that this government has signed, this is their responsibility. It's happened on their watch, and so far the only outcome we've seen from this Rwanda policy is the Rwandan government laughing all the way to the bank because the silly British government has handed over hundreds of millions of pounds.
But you would leave these people there?
Not a single deportation flight taking off.
You wouldn't bring them back, you'd leave them there?
I'm not the Shadow Home Secretary. I'd have to look at the detail of the agreement. But,
Mr. Streeting, thank you, Wes.
You know, once people are settled, you can't just undo that.
All right. Thank you very much indeed for joining me this morning. Have a very Merry Christmas.